I actually heard someone say the other day, if you fund crisis, you will always get crisis. If you fund prevention, you get early intervention. And so we're starting to see government pivot towards what does early intervention look like, because if you get that right, then your crisis is not a crisis anymore.
Welcome to the In Our Minds podcast. My name is Bianca Bowron-Cuthill and I'm CEO of Innowell. Today, we're going to be joined by Gary Groves, CEO of ReachOut. We cover a range of topics in today's chat. Particularly, we cover Gary's background and his vast experience prior to coming to ReachOut, the impact that ReachOut is actually having on young people, and finally, the role of technology and how organizations like ReachOut are leveraging technology to deliver amazing solutions and ultimately help provide support and services to young people as they navigate their mental health care journey. Gary, I'm so glad to have you here. Thank you so much for joining me today.
Yeah, very happy to be here. Have a chat.
Yes, absolutely. We're going to cover a lot of ground in today's podcast. And so to kick things off, obviously you have an amazing backstory and amazing history as CEO of ReachOut. Can you share a little bit more about your background with our listeners and viewers today?
Yeah, sure. So I'm very humbled to have the background I have. So I started my career in the New South Wales Police Force. And spent 15 years, everything from working general duties in King's Cross in the late 90s right through to leading the Child Protection Sex Crime Squad the last 6 years of my role. So that was really ambitious and defining for my career. And then I thought I could definitely do something else that had more impact. So I moved across to Family and Community Services, which was more about how we look after children who are removed from their parents. And then I got the taste of the NGO sector, which I couldn't resist, and knew I could even have more impact. So I moved across to Jewish Care and managed that organisation. And then finally I found my niche in my life, which was called ReachOut.
Amazing. And obviously that's where, the connection between ReachOut and Innowell has formed and continues to sort of blossom. I'm very proud to be part of the Laps for Life community, and that's obviously how we came to meet. And really today, I'd love to just sort of share more about your journey at ReachOut and particularly what your organisation does, because I'm so passionate about what you're doing in youth mental health, and there is such great value that you're adding to the community and how you're helping young people. Do you want to share, if anyone hasn't heard about ReachOut Australia before, can you share a little bit more about, what they do or what your organisation does?
Yeah, sure. So ReachOut was born probably 25 years ago, and it actually was instigated by a Triple J hack that long ago, where people wanted to raise money for someone who unfortunately had ended their life. And it really moved quickly from a web-based content type product right through to digital engagement, which is what we have today. ReachOut really is an organisation that is meant to and does support young people during their time of need. So we always want to be there as their digital first step. And we provide really live content, so what's worrying them in the world today, right through to peer chat, which I think is a super cool service where a young person can get on their mobile phone and text one of our workers who have lived experience. And often the gold in the organisation is the fact that you can talk anonymously, not be judged, have a conversation, and almost move to the next step of your mental health journey. But what we acknowledge is the social fabric of any mental health person's journey really is having your parents or carers or a friend support you. So we have a great parent-carer coaching service, which is strength-based. So really how, as a parent, you coach your young person when they're going through a mental health challenge. So we really meet the needs of around 2.5 million young people a year, which is significant for us. But more importantly, we're there for when they need us the most. And it can be through content, in particular using AI, or right through to actually having a chat.
Yeah, I think it's so amazing. I think I've got 2 teenagers, and I was literally talking to my son the other day about school. He's in year 11 and a friend of his is going through year 12. And I asked him, I said, how's such and such going? And he was like, And I was like, do they know about these services that are out there? Because I think it's organisations like ReachOut who can help kids at varying different stage of what, whether it's low, medium or acute needs, but also just navigating the complexities of school and study and just life. So, you've got so many amazing, so much content, I think, that it's available for different stages of where youth are at in their journey. It's really, really valuable.
Yeah. And look, what I like about it is often we're very engaged in TikTok and Insta, and so our young people will often come back to us. We call them our youth ambassadors and say, have you seen what's trending on TikTok? How about we develop some video content to post to really help educate young people about what they're seeing online, which is really important as well.
Love that. And it changes so quickly in terms of what's happening, like the sentiment, what's happening around them. So the fact that you're able to pivot and adapt so quickly, I think is absolutely huge and ultimately a huge value add. So, you've spent years inside the New South Wales public sector, as you were saying, in police, Department of Justice, and often you've focused on supporting those vulnerable populations. What was it initially that drew you to this space and what's kept you there?
Yeah. Working in the New South Wales Police, I really saw the worst in people, the most fragile, but also the most vulnerable. And what frustrated me the most is day in and day out, I would see young people struggling with their mental health issues, their addiction to drugs, domestic and family violence. And I just knew that became a cornerstone of my career where it was there, but I couldn't see anything happening that was really what I'd call early intervention and prevention. And so when I was moving through my career, I started to realise that is where the passion lies. And I often remember mentoring when I was in the police in Woolloomooloo. So part of our role was how do you reduce youth crime? One of them is actually engage with young people about what their issues are. There's always a reason behind these things. And we worked with kids 5 to about 12, and we had a mentoring arrangement with the Defence and with New South Wales Police. And I had this young boy who I was mentoring who was struggling at home. And back then, ADHD and all the mental health challenges we talk about today weren't things that were spoken about back then. And so you could see this young boy was really struggling with life. And I mentored him for a few years, and then he disappeared. And he was a First Nations young boy, so I believe he went back to his community. What was really interesting is about 4 or 5 years ago, I was walking down to the PCYC in Woolloomooloo to do boxing, and I could feel this stranger following me. And when you're in the police, you're always looking at who's around you, who's behind you, who's in the revision mirror of a parked car. And he came up behind me in the dark and said, "Gary," and I turned around and I didn't know who he was until I looked into his eyes, and I said, "Oh, that's you." And he said, I never got to thank you for what you did. And I said, "I didn't do much." And he said, "Yes, you did." He said, "I went to school and now I have an apprenticeship and now I have a family." And that point, I knew I'd made the right decision to actually move into an organisation where actually, imagine if ReachOut was around back then and I knew about it and I could have pointed him towards that that website to get content or to get help. So it's like that. And that story kind of resonates with me constantly to go, you know so what, that's just one person. Imagine what you can do at scale.
Oh, and I think it's like when you're teary thinking about it, because I think you don't realize sometimes that you have those moments when you realize that impact, because you're obviously, you're a busy exec, you're a CEO, you're doing so much and your brain's constantly thinking about how you can help others. But when you have that moment that literally stops you in your tracks, you kind of go, like that's why I do what I do. I can imagine you would have countless versions of those stories. It really, as you said, it really puts it in perspective, particularly when you're switching into that full purpose, that sort of full purpose space and that impact that you're creating. That's amazing. Now you've spoken about how this work is very personal for you and how that, you were one of those people that could have used that support earlier. But if you think about, how much of what you do now is shaped by even your experiences.
Yeah, it's a lot actually. And you don't think about it until you're in the role about how much growing up has actually shaped your career. I never, ever, when I was young, thought I would be a CEO of an organisation, nor did I think I would be even in the police force. But the universe pushed me that way. And I'm one to say that, I've shared my own lived experience, and often my psychologists will say, you always get asked the question, why did you join the police? And I could never answer that question, because when you talk to my police colleagues, I'll say, oh, my grandfather was a police officer or my sister was. None of my family was in the police. And so I always struggled with the why. And it's interesting because when I actually go back in my life, there were lots of issues in my family where I just wanted to do good, but I was one of 8 and I was in the middle. And so I had this, I need a voice, and I felt like I was never heard. And so that led to a number of issues for me, including depression and other things. And back then, you just picked yourself up off the floor and you kept going, which is called resilience. And so I built that resilience. But what I worked out is in the human services sector, in fact, when I was growing up, all I've ever wanted to do, and it's very cliche and we use it a lot, but it's true, you are shaped or defined by your childhood often.
Totally.
And I just wanted to help other people not experience what I experienced. And it wasn't bad. It was just that was the time in the 80s. That's how we all managed. And it really has, in the police, I just wanted to make someone's life better. That's it. In human services, I just want to help people. And I often, to your point, think about that in a lot of my decision making, going, why am I making this decision? Oh, I remember, because I never had that opportunity when I was young. So it does definitely shape your values and who you are today as to why you do what you do.
And so with ReachOut, like what was it that, that it made ReachOut, like specifically the next right chapter for you? And what did it have that other organisations didn't?
Yeah, that's a good one. You asked the best questions. You know what? It was my aha moment in my career, I think. So I was very happy what I was doing at the last organisation, and I was aware of ReachOut and what they were doing, and we were doing a collab with the organisation I was working for. And when I saw it, I actually thought, wow, there's an organisation sitting there that only focuses on young people's mental health, nothing else. It's young, it's digital, it's progressive, it's where the world is going. Why wouldn't you versus why not? And so I just jumped at it. And I was very fortunate to be interviewed by a significant, very experienced board, including Ian Thorpe, which I was sitting in a room and I remember going, I can't believe I'm being interviewed by Thorpe, a 9-times world champion gold medalist, asking me the questions.
He was such a lovely human being. So,
But then I actually realised as a CEO, you can have a tangible impact in an organisation where they only have one focus, which, as you would know as a CEO, you have 1,000 things going on. But in fact, the only focus we have is young people's mental health. So it was the gravitational pull that I wanted, and I was very happy to move across into something midpoint in your early 50s. That is actually, I'm really happy here. I can be here for a long time and still be happy. And wow, I'm making the difference in something I always wanted to do when I was a kid. As I said, and I wasn't looking, right? It just kind of presented itself. So super humble and very lucky to run it. And it really is engaged by young people, right? So I think I'm the oldest there at the moment, but we have lots of young people, young at heart, and lots of memes and lots of different words that I've had to be accustomed to, and the way we talk is very different. But what's cool is our policy, our advocacy, the way we digitalise our products, our services, and young people's experience is totally curated by young people. You don't see that very often in organisations, which I think is just like it's really refreshing.
Agreed. Yeah. And I think it's that vibrancy is, my sort of whole philosophy in stepping into the mental health sector myself is that, whilst I don't have a clinical background, I have a tech background as well, and different experience that have shaped, the role and what we're trying to build at Innowell. It's also trying to help remove the stigma that's associated with mental health. And I think the great work that you and the team at ReachOut are doing is through that connection, as you're saying, even just through connecting with peers, to go, it's okay. We all go through different stages and journey, not to minimize it, but to help normalize. And for me, it's also about just really doing whatever we can to help reduce the stigma or remove the stigma associated with mental health.
And the stigma is, people say the stigma is no longer there. The stigma still exists,
I agree.
Just in different forms. It can be online. It is still there. So I don't think we should ever forget that our job is to reduce that stigma.
Agreed.
So people can have that access that they've never normally had access to.
Yeah, absolutely. And so for anyone, when you think about ReachOut, and you sort of shared some insights about what it is that makes it special, from your perspective, what is it that makes it stand out, and what is it that makes it so special to you?
Look, I think one, we're completely, we cover the entire country, which means that 24/7 you can have access to what we do, which I think not a lot of organisations can offer that. And we have content that is so relevant these days, and we can push our content really quick. And I keep thinking, when I was young, what would I have wanted to help my journey? And that's something I constantly ask. I think the gold is in having a workforce that I said earlier on is so in touch with young people. It is not my job to say what young people think. It's their job to tell us what they think. You can't buy that. And we are really privileged at the moment with artificial intelligence that we're starting to really hear anonymously around the country what young people are talking about. And again, we use that to our advantage. Data is really important right now, and what we think 3 years ago is very different to what's happening right now. So having access to data and then being able to produce content and develop services is, you can't do that anywhere else.
No.
And an organisation, as you know, that's tech savvy, you don't have to have an FTE of 1,000 people.
No.
You can be small, agile, and pivot.
Yep.
And that's probably another cool thing about ReachOut. They've done it in many iterations over 25 years. And even pivoting to AI was our next part of our journey, and we're doing it.
Yeah. But I think particularly, as we know, with young people, as you said, trends and challenges can emerge, whether it be, economic. Then, like obviously, economic challenges, can be different. But I think even just like the world challenges and just geopolitical stuff that's going on at the moment, that can obviously affect youth in different sort of ways, whether it be job security, travel, all those sorts of different things. So the fact that you're able to pivot so quickly, I agree. Not having that corporate mindset. You can still have a corporate structure and sophistication, but it's the ability, as you said, the ability to move quickly and adapt and pivot in terms of where the market is heading and what content, youth particularly are needing right now. I love how you've got a lot of that, the algorithms and the content to show like not what's trending for the sake of what's cool, but what's impacting certain communities in different parts of Australia. I know you and I have spoken about this off camera before, but I've loved the fact that you've actually got some of that insight in terms of what are some of the different trends, particularly in regional settings. What challenges are they experiencing versus maybe say kids in a CBD metro area? Obviously, there's some different challenges there. So technology can really play a huge role in that.
Yeah, and being where young people are. So this assumption that young people come to you.
Yeah.
As you know, with your own kids, that's not correct.
Not always the case, no.
And so actually making sure our products and services are pushed into either their social media or whatever type of platform they're on is really critical. And that's the biggest feedback we get is we want access yesterday, we want content yesterday, and we want it short and sharp. Don't give us a fact sheet to read. And we're not going to Google you. So
exactly.
Actually making sure that we're relevant in spaces where young people are, in particular institutions like schools and tertiary places of interest are still important, but that digital presence you can maneuver really quickly compared to the face-to-face human interaction.
Definitely. And I think it's, as you're saying, it's we know that there's so much data that shows that a lot of young people will often start their mental health exploration utilizing, whether it be GPTs or any other sort of AI solutions. So the fact that, you can actually sort of meet them where they're at, but also guide them safely to content that has been, purposely and purposefully, I should say, curated to assist versus letting them sort of, find their own, choose their own adventure, I think is also super, super powerful.
Yeah. Trust is big. I think one of the things I saw about ReachOut was it is a trusted brand. And whilst we have our other AI chatbots out there and we know young people use them all the time, we really want young people to come to a place where whatever we give them is clinically based. It's just given to them in a conversation that they understand, which is super important.
And so, your data suggests that around 1 million young Australians aren't seeking help for their mental health. What do you think that's stopping them?
So many things. Look, I think number one, cost of living, people kind of discount young people in that space. We know mortgages hit adults, but in fact, young people, when we talk to them, they'll say, I'm working 3 jobs. I have to study. I'm going to uni or TAFE or I'm doing online learning. So I actually can't afford to see anyone. That's the first one. So cost of living has a massive impact on what's affordable and what do I give up. Problem number one. Number two, social isolation is a big one. So in rural and remote areas, it is very difficult to get access to a psychologist or a counsellor. And also when you do, in small towns, everyone knows everyone. So young people don't feel comfortable talking to those people, hence why that anonymous, digitally online type of service is important. And look, the other issue that's really important to young people is waiting times. So even if you do get in to see someone who is a mental health clinician, it all takes time. And young people as I said before, when they call out for help, they expect
Want it now.
someone to come to them and give them that help.
Yeah.
And I think around 40% of young people who engage with a psychologist and have a 6-month wait will pull out
Yeah.
and actually miss their first appointment. So there's so many complexities that sit in that space. There's no real one answer to it, but what's interesting is access, super critical.
Yeah.
And people can't afford the Medicare rebates these days. So great, you get 10 sessions, but I still have to pay for it as a young person
exactly.
unless it's free. And one of our ethos at ReachOut is we will always provide free access no matter what it is. So everyone has a level playing field and at least can get some content. One of the biggest things young people say is if I go to a psychologist, give me a video on what I'm walking into, because for you and I,
Yeah.
we're relatively comfortable with that notion, but for young people, they're not. So there's also a stepped journey that young people need to go on as well.
How to sort of guide them. And I think, as you said, it's there's so many layers to that sort of complexity based on whether you're, metro, whether you're regional. Even I've spoken to clinicians, and that, as you said, that no-show rate for their clients particularly could be things like transportation challenges, or their youth may not have enough money to get public transport, or they're too far away. And there's things that we sometimes, being in the city, you actually don't think about that to that same extent. So I think the fact that we're all having these conversations to work out what we can do to improve the experience, to meet people where they're at, is how we will drive change. Obviously, it is a journey. It's going to take a while, but the fact that we're all out there, advocating for that change, I think is obviously it's got to start somewhere. So it's great the way you guys are thinking about how you can adapt to meet the needs of young people. It's super powerful.
Yeah. And the other thing which is really important is we've kind of created the problem, right? So there are many mental health providers around the country. There are so many, it is very difficult to better understand where you fit in the ecosystem.
Yes.
So for a young person in the middle of the night who's going through issues, even to try and navigate where to go is complex. And when you do also get to go to the place you want to go to, if their books are full, you have to go back to stage one, which is where do I fit?
Yeah.
So we have to own that problem as well. And it's collaborations with people like yourself and others to go, how do we make a user journey much more seamless?
Definitely.
To help a young person, or any person for that matter, on their journey. So I think there's a level of accountability with us to make it happen for them.
So how do you actually measure your impact? When your service is built around early intervention and prevention, how do you measure the impact? Because ultimately there's a lot of content that's in the platform, but what are the steps that ReachOut are taking to help measure impact?
Yeah, impact's really cool actually. So I think the NGO sector's moved in the last probably 6 years of how many hits you get on a website through to actually what is the difference you're making for a young person online. So we used to measure the number of clicks and how long someone stayed on the website. And now we're moved to when we engage with someone on our peer chat service, for example, we'll ask them at the end anonymously, did they find the content and the discussion helpful? Now, single service interventions is something that's being researched extensively around the world right now, because there was a point in a mental health journey where people said, one-offs, they don't help, they're not good. But in fact, when you think about the fact that a young person has stepped up to have a conversation, a single service intervention is crucially important. It's the start of their journey, which is where we see ReachOut. And so we often ask them, did this conversation actually help you on your journey? And so we start to get feedback, and it's not just a thumbs up. They'll tell us how they feel, which is what we want. So we begin impact through conversation. That's the first thing. And parent carer coaching is really important. So parent carer coaching a much easier way, because we have 4 to 6 sessions with parents, and we often say the same question. Did this just actually help you navigate your young person's issues? That feedback is really important. Not this yes, no. We want the conversation and the dialogue to actually help us improve our services. And I actually think it's really important when you're talking to government. It's not about the number of, scale's important. It's actually if people really engaged and helped their journey to wherever they were going. We're the start of their journey, we're not the end, but the start, as you've said earlier on, you could be 10, you could be 12, you could be 21 and the start of your mental health journey begins. If you've had a good experience, then you're going to engage further. So it helps define our products. Our donors really like to see their impact. And it's a great story back to government.
Yeah. And I think when you think about even just that, the insight from a parent's perspective, parents obviously if they know that they're dealing with someone who's in a very fragile state, like that's a terrifying, responsibility to be in as a parent, caregiver, whatever the case may be. So even just the fact that you're taking on their perspective, I think is really powerful, because we talk about like the circle of care and the elements that everyone plays in someone's life. That's a huge way to make sure that their feedback is also being considered as well, and how you can continue to improve the services you're providing.
And it's super cool when people come back too. So people often think a return consumer, that means you didn't answer or help them initially. Actually, they say they come back because they've got another question to ask, or they have another concern or worry. So impact to us too is we like people to come back.
Absolutely.
And we're measuring in AI now. How do you measure impact in AI? And part of it really is, are we giving them the right content and the conversation? Again, that's impact. If someone can access trusted information at the time they need it the most, then we are generally having impact.
So what are some of the common misconceptions about youth mental health and how to improve those outcomes?
Yeah, youth mental health. I think people often think having one intervention solves everyone's problem. So you come to ReachOut, you engage with us, problem solved. Actually, as I said earlier before, mental health is not linear. It is complex. It can be worked through. It often comes back. And so having ongoing dialogue or interaction with the mental health system when you need it is crucially important. So misconception number one is one-off. No, it's often a journey, and I don't think I've met anyone who said I had a one-off intervention and I'm all good.
And I'm done.
Yep.
I'm fixed.
And
never.
that's humans. That's who we are. We're complex.
We're complex, yeah.
I think the other one is that in particular young people, and I said this earlier on about access, young people these days could just say how they feel and they get the help they want. They don't. In fact, I would argue in some spaces talking about your mental health is great, but in fact the misconception is people still think if they talk about it, they're being judged, in particular in various communities around the country. And whilst I think we're a privileged first world country, mental health for young people is still extremely present. And I'd argue the premise that, you get access, you get better, we're all good, is not correct. And I think we live in a very complex world now that whilst we do have access to probably one of the best healthcare systems in the world, it doesn't mean we get better quicker, and it doesn't mean we don't have our own problems and complexities. So really, I think they're the two biggest ones to me. The other one is that younger people don't need help. We know that kids from around 5 up are having access in various ways to digital content. And so at ReachOut, we are now looking at how to engage with children to actually help them on their journey at that age in a very different way. Awesome. For example, kids watch YouTube all the time. How are we interfacing with YouTube kids? So that misconception about kids not struggling at that younger age, it's been there when you and I were young. It just was never identified. It's just more complex now. And they have more access to information, and information is in fact at the heart of everything now.
Agreed. Absolutely. And I think, and also, you think about the online landscape. Like I think, when my kids were, they were playing Roblox and all these sorts of different sort of games at different stages, because like even back into the early lockdown, in the early stages of lockdown, it was a way for them to sort of engage with friends and online communities, because that was their only way. But we had to navigate, the safety aspect. There's so much we needed to do. So I think you're right. The younger kids, like for me at, 5, 6, 7 and 8, I wasn't online gaming because that didn't exist back then. Same thing, child of the 80s. It didn't exist back then. But we look now that we're putting technology in the hands of people younger and younger. So you're right. It's how do we sort of help them navigate that safely, recognizing it's going to surface in different ways. I think is really important.
Yeah, I heard a great analogy from a young person once, and I spoke earlier on about being the oldest person at ReachOut. So you learn lots when you are that age. And he said, like when you were young, you played in the backyard, you climbed trees, you did all the things that you did for your age. And often you had a parent watching you, or maybe you didn't, and you fell off the tree and you hurt yourself. And maybe you did run into your mum and dad and say, I hurt myself, or maybe you didn't because you had that strong facade that you wouldn't do it. He said, we're online doing the same thing. We're kind of learning as we go. We're climbing the trees, but they're digital.
Yeah.
Sometimes we talk to mum and dad. Yeah. Sometimes we talk to our friends. Sometimes we say nothing because we're embarrassed. He said it's the same premise, it's just different. And it's not going away. So digital is our life. Yep. We're in the information age, and we'll be in that age, and it'll get more complex. Yep. So you need to think of us as you, but in a digital world. And it's kind of true.
Really
right?
cool way to think about it.
It's a different analogy, but yeah, you're right. We did things that we didn't want our parents to know about. And,
always.
And then we also did things where we needed our parents' help. And to your point, as a parent, how do you navigate a young person's journey if you're not in that journey or understand that young person's online experience?
Yeah, absolutely. And it becomes that sort of that rite of passage that we know, as you said, we all have that rite of passage, whichever generation you're a part of. But as you said, just recognizing that it just might look a little bit different, but it effectively is the same form of rebellion, the same form of sneaking around. We all did it. I joke with my kids now. I said, we've all been there. We've all done it. Don't think you can, don't think I'm stupid. Like, yes, Mum. But it's the point of just knowing that it is a normal part of teenagers as an example, but I think it's a normal part of that natural act of rebellion, but it's navigating it as safely and knowing that we all make mistakes, but knowing who to reach out to, when you do have a situation where you do need to speak to someone, hopefully you feel comfortable doing that with your parents, but if you don't, you've got good advice and good sort of support networks wrapped around you. You've talked about AI and I love some of the technology and the approach that you're adopting at ReachOut to help sort of scale in terms of content creation and those sorts of things. Can you share a little bit more with the listeners around how you're approaching technology and building that in as part of your business?
Yeah. So again, when at ReachOut, because it's such an organisation that needs to move with the times, we don't stay static for too long. So as you know, doing a strategic plan doesn't really sit on the shelf for much. Young people kind of said to us, we engage with AI. And so the premise of we're in it already, but we want trusted information and content. Tell us what you can offer. It was kind of the alarm bell, the red flag thing, going, how do we move into that space? And it was a big decision for ReachOut because it does come with an element of risk. And as we know, we've seen experiences overseas where various AI chatbots have gone rogue and disastrous things have happened for young people. And so part of the building the model or the concept of care, as we call it, was building in a care layer. And so we, in essence, looked at all the information we have online. And if you look at the back face of the web that we have, the interface, we have, like 850 evidence-based articles that we were pushing out to young people. So the construct was, how do we take that, talk to our AI family and actually give it back to young people in short, sharp content pieces that they understand, where they don't develop a relationship with AI. So empathetic AI seems to be a major contributor to a young person's downfall, in particular if they've got no one else to talk to. So a relationship develops. We don't want to be that. No. What we realised was, one, content's important. We know that. Two, relevant, curated information at the time they need it the most, important. But having a human connection is the glue that is required for AI, something chatbots can't offer that we're offering, which is you can talk to us, to our AI Ask ReachOut, but if you don't want to talk to that, you can actually talk to a human. And young people said we still need that human interface, whether that's like a text chat or us diverting them to another organisation that can have the right chat at the right time, super critical. Yep. And we were lucky enough to land a partnership with Google to develop our AI interface. And it's super cool, right? It's something where we call the walled garden, so it is protected. And we also have built, I see AI like a family. You've got mum and dad, and then you've got all the kids, and they all have different qualities and values that interact before you get the content. And so making sure that our content is of a quality that's accepted and having the care layer, super critical for a young person. So we're on a journey, and whilst we launched it in March this year, we've had around 8,000 conversations to date. Wow. We're predicting about 100,000 by the end of the year.
Huge.
You can only get better in that space, which is for a young person, if that's what they need, then that's what we'll provide with that human connection. That is critical, and the interface is really important.
Yeah, I love that. And so as part of that, and obviously that's building, as you said, Ask Reach Out, where you've obviously launched that AI tool. What is it that you think that AI can do really well in this space, and where do you think it's falling short?
I think for Reach Out, what it does really well is it is reading the conversation of the young person, finding the right response to their question, and providing it in a way that is factual and correct and gives the young person where the information is coming from so they can trust it.
Yep.
So for us, that agentic AI that can do quality, that can, in essence, test the information before it gets to you in nanoseconds, works really well at a pace, right? So when we were building it, the latency, which is when you see the dial go round, young people are going, I'm now going to go off and find it somewhere else. So the speed factor is super important to young people. And, we're all impatient these days.
Yeah, absolutely.
So that was important, and the quality of information to a young person. If you've got a walled garden, so it is closed loop, really important. Where it's falling down, I think more broadly, is we're in the information age.
Yeah.
So young people want answers to all their questions, mental health or not mental health. And we're quite specific. Other AIs are not. And that's where you can get information that potentially is not correct. And it's causing harm to young people versus good. And that is something I don't know if it'll ever land in the ecosystem of AI. But how you get that information, I think, in the future, really important. So I think that's the bit.
The trusted sources.
Trusted source, really important.
Absolutely.
Really important.
So when you think about then switching gears for a second in terms of the role of government in improving mental health outcomes for young people, what would you see is the role that government can play? I know you do a lot of advocacy in this space. What do you see in the government's role and how they can help?
I think you're starting to see a little bit of governments really stepping into mental health. So as you know, government funds crisis mental health. So I always say that's your accident emergency end of the mental health system. And I actually heard someone say the other day, if you fund crisis, you will always get crisis. If you fund prevention, you get early intervention. And so we're starting to see government pivot towards what does early intervention look like, because if you get that right, then your crisis is not a crisis anymore. The problem with that is that you don't see remarkable results overnight, and government terms are often 3 or 4 years. So there's a conversation back to government, which I know federally they're listening to, about how do we prevent or intervene much earlier in a young person's life to stop the crisis at 14. It has been evidence-based and researched to the nth degree around the world. We know it works. Everyone knows it works.
Definitely.
The funding envelope has to come with that. So I often say to donors who say, well, government can fund that. Yes, but government can't fund everything.
No, that's right.
They're there as a legislative institution to support its citizens. It is our role to bring the problem to the table. And then I would say it's our problem to solve. So both government and the sector and private investors and technology. So I think, that's a long-winded answer, but in essence, they do fund early intervention. They do fund crisis really well. They have to start looking at more broadly that user journey and where it starts and where they invest a lot more.
I agree. And I know you and I have spoken about this separately, but when you think then about, if you flip that over to like the private sector and what those sort of partnerships could look like, what do you think that sort of, what is a great example of, sort of partnering in the private sector and what those partnerships could look like? What would be your point of view?
Yeah, there's so many opportunities. So I think in the private sector, from a technology perspective, we have what you want. We have young people. We have the base. We have the technology. How do you help us help you? And so technology is a great one where there are a lot of private organisations who are in this space, but in fact, we're not against working with private investors. We think it's actually a really cool idea because often some of the best ideas in technology come from those startups. So technology and how it interfaces is crucially important. Corporately, I think there's a real opportunity for young workforces and how you get productivity and motivation back into those young workforces, critically important. So we know our EAP providers, for example, are starting to look at what does mental well-being look like. And we often go to and talk to corporates and provide webinars on parent-carer coaching. So if you look at a workforce of some big organisations, there are a lot of parents who still struggle with their kids. These webinars, they're going, wow, we didn't realise it's like this will get people back to work. Young people, how do we get them into our workplace if they're at home because they're being bullied or they've got high levels of anxiety? How do we work with non-for-profits like yourself to provide that content through some type of sponsorship? So they absolutely do play a role, but in fact, they also get a significant benefit from partnering with NGOs like ReachOut and others.
So when you think about then the role that ReachOut has played as being a part of a coalition for pushing for a digital duty of care for social media platforms, what does that mean from a practical perspective? Given you're talking to youth, you're talking about social media, and obviously there's a lot of scrutiny and opinions around, the social media bans and what have you. How are you guys sort of approaching that particular challenge?
So we're using young people's voices to influence the duty of care policy that Canberra are currently working through. What's interesting is we're advocating along with our coalition to say, one, they need to have a safe experience online. So how do we influence our platforms to have a safe algorithm? So how do we push good mental health information into sometimes often bad information online? So when you think of duty of care in the real world is how do we protect young people from what they see online? One of it is education. We want more education in the schools. And at a much younger age, we want parents and carers to be more informed about what their kids are seeing online. We want government to have a legislative response to platforms similar to what you're seeing in the social media ban. And we also want a level of research to know that what's working and what's not, and for government to invest in research about young people who go online and the impact on their mental health. All those together really have what I would call a good recipe for protection. Yes, social media companies have a level of accountability, and I don't think anyone in the room disagrees that it has had a negative impact. Therefore, we know where young people are. They're still online. So how do we have a blanket or around them to protect them? One's about education. One's about making sure their algorithms are not biased, and young people control their content. Now, you've seen, and very happy to mention, Instagram are slowly starting to educate teens on what they can and can't see. Great start, but it's not the end because more platforms will pop up. And educating parents is probably the big one for us, so they know what their young people are experiencing. But the onus very much sits with the platforms and to a level government and accountability.
Yeah, absolutely. And I think it's also, I think you can, as a parent, you can try to resist and I've been in tech for 26 years. So for me, my children's relationship with technology is a really interesting one for me because whilst you need to, for me, it's a case of, walking the walk and talking the talk. For me to have blanket bans on technology where mum's living, breathing, working in technology organisations felt very inauthentic in terms of how I operate and how I live my life. And so for the kids, as they were growing up, I think it's about navigating it safely, being aware, making sure they knew what information they shouldn't be sharing, address, personal information, but also if they made a mistake, let me know. It's okay. Like, we're humans. So if we can help educate parents that saying this is where kids are at and what they're doing, that's also going to help them have hopefully really great, open, honest conversations with their young people as well. So it's a bold area to sort of navigate through. But as you said, it's great to hear that you're already seeing that Instagram and others are already on that journey.
Safety by design is kind of the key words we say, both from a parent's perspective, but also from an online
absolutely
point of view.
Yeah, I love that. As I sort of said at the start of our chat, you and I first came together and met through Laps for Life, and again, being a former swimmer, very very passionate about the mission that you're on and how your organisation's committed to the Laps for Life challenge and how to sort of again reduce the stigma and really support young people in Laps for Life and what that campaign represents. How did it come about originally? I'd love to know that origin story around Laps for Life.
So it's an interesting concept. So we know that water calms people. It's been
Agreed.
evidenced in research. What we realised was that there were many people out there who were swimming up and down the pool lane to actually clear their heads because of something that had happened to them in regards to the mental health challenges they were experiencing. And I do credit Thorpe for a bit of this to say, well, why aren't you embracing what people are doing, which is in essence a healthy lifestyle and living, to ask people to actually swim for their mates or swim for a special cause. And when it first started, we were the only ones actually with this interesting campaign. And I know there was a lot of feedback to go, well, not everyone's a swimmer. Well, that's okay. Get someone who is a swimmer. But what we found out through the networks is there was always one in a group of friends who said, I'll do it. There was always one in a family, I'll do it. And when you hear the stories, there are people who can just swim one lap. Great. That's all you can do. It's actually about the why. And more importantly, helping yourself too. And when you hear the stories of why people were swimming, and you're talking young kids all the way up to, I think the oldest was 83. Their stories are heartbreaking, really heartbreaking. And everyone knows someone that's experienced a mental health challenge, or there's been some serious consequences. And they'll say, but I swim and it's exhausting, but when I get out, I feel like not only has it helped someone else through fundraising, but in fact, I feel better myself. And you often hear the stories from Thorpe of swimming a black line since he was 7. I'm like, how can that be healthy? And I remember saying to Thorpe, we have one thing in common. I did the same thing, and it's monotonous. But he has a point. When you hop in the water, you think. No one else can interrupt you. You don't have a phone to your head, and you have to concentrate and focus. And it's amazing what it does for your mental health. So the campaign kind of really imploded out of that to a point where we have about 10,500 swimmers now swimming. It's a few times around the world if you were to add all the kilometres.
So cool.
And it's not stopping. It's something that is just growing and growing. And we see a lot of other organisations doing the same thing. And we're not, competition is great, but in fact, it's a really good thing to do.
I agree.
And as you know, swimming, I think, for me, I do ocean swimming, and because I can't follow a black line anymore. But ocean swimming is cool because you have to navigate the waves. You don't know what's swimming underneath you. But gee, you feel good when you get out, even though you might be exhausted. It is the point of actually doing something for yourself. And clearing your head.
Definitely.
I think it's amazing.
Yeah, and it's really unique. You know, I think whether you swim, run, you know, I tend to do both when I'm feeling fit. But the running aspect, you're often chatting and catching up, and that's fine. But it's not as much about you, because you've often got you might have a podcast or some music on. But when you're swimming, it's really hard to do all those things at the same time, to talk, to to listen to music. You could, but the whole point of it is it's about you. And as you said, I think the value of Laps for Life is that it's often then putting a personal connection, because you're doing it not just for yourself, but you're doing for someone else as well, and trying to help someone, as part of that. So I was very grateful to be a part of it this year, and it won't be my first and won't be my last time, put it that way. But I think it's amazing. And as you said, having an ambassador such as Ian is incredible, because not only obviously, as you said, he's a board member and the public face of the event, but I think his willingness, and we're able to hear more of that story at a conference recently. His willingness to share his own story, it's unlocked a different relationship beyond a traditional ambassador. What do you think has added to that level of sort of authenticity is probably the word, in terms of that credibility of him being an ambassador? What do you think in terms of that connection between Ian and Laps for Life and ReachOut? What's been that magic sort of connection?
I think Thorpe brings a level of vulnerability, who is a very high-profile, well-known achiever. And as you heard at the conference the other week, he swam from a very young age, but in fact it was his sister who kind of got him in the water, right? He wanted to be better than his sister, and he talks about his journey. And his journey wasn't great. But the way he promotes it, the way he still has relevance in the community. I remember we were talking the other day, the 25 years since the Olympics. And he walked into a school of kindergarten kids who were screaming his name, both Thorpe and Kathy Freeman, going, you weren't even born when this man was achieving remarkable results. He's still relevant because he's still authentic in the story he tells. in comparison potentially to other people who've achieved similar goals. But I think he keeps it real, and he's never moved away from the person he is and who he wants to be. And often when we're in a board meeting, he brings that level of vulnerability to the board meeting that you just cannot get anywhere else. And I remember when he was training me for our CEO Laps for Life, and I was saying earlier on, I'm a good swimmer. And when he was teaching me, I'm going, it's surreal to have an Olympian teaching me how to swim again.
Huge.
And in fact, I learnt more out of the water with him than in the water. And it was all about preparing yourself for getting into the water. And his pieces of gold, like his advice, you just don't get that anymore. So his relevance is super critical. And a lot of people look up to him merely because of his experience and his journey. Really important to him. And vulnerability plays a major role, both as CEOs. You need to share.
Absolutely.
Otherwise, you're not believable.
No, exactly.
People don't know what cause you're in. And we're just very lucky to have him.
Yeah, absolutely. And it's ultimately, as you said, not just that vulnerability, that authenticity, but at the end of the day, we're all human beings. We're all human beings. We all connect in different sort of ways and shapes and sizes. And I think, seeing Ian, I was fortunate to know Ian at a young age. Him and my sister were really close in swimming, and I actually competed against his sister Christina, so we knew the Thorpes growing up, and it's difficult to see what Ian went through, but it's just really powerful to see where he is now. So it's really cool. So I'm going to get emotional thinking about it. But I think it's amazing that you've got such a wonderful ambassador in Ian, because he's a wonderful human being. So kudos to you and the team for having Ian as part of your extended team.
He has a heart of gold.
Oh, he absolutely just always has. Beautiful human being, and seeing that now on a such even bigger platform, and how he's giving back to young people. And as you said, to have that sort of reaction with kids who weren't even born, and back when the Sydney 2000 Olympics and those days, is just absolutely incredible. So you talked about, last year 10,500 people swam nearly 99,000 kilometres and raised $3.4 million. So that is a huge number, and particularly for a not-for-profit. I'm so glad to see that you're getting that level of impact in terms of these kinds of these sort of fundraising campaigns. What does that community mean beyond the fundraising number?
It is our how do I explain it? It is almost like our fan base. It is a community that doesn't stop growing. So if you think about it, you have the swimmers, and then you have the team that sits behind the swimmers. And some swimmers have 30, 40 people sponsoring them to do laps. Some just have their family. We see that all of them, it's a bit like sales and marketing. We see all of them as ambassadors of ReachOut. We want them to tell their stories. We want them to tell other people about why we exist. And one of the things I often do is do personal calls to those who do more than 10Ks or achieved a certain amount. And you just talk to them and they'll say, Gary, we went and told so many people about our experience with ReachOut, and we feel through our story we've just helped someone else who's connected with someone else. And so that fan base is crucial to the success of ReachOut. Without that human talking to another human, we wouldn't be able to do what we do. And so it's a base we never want to lose. And if you add up the number of people who've done the swim, it just grows and grows and grows.
You've obviously had an incredible career already, and also, incredible journey at ReachOut. And I can see there's still so much more to be done. Just, getting to know you, your passion. I think it's, we know that there's systemic change that we're both equally passionate about wanting to drive. So for you at ReachOut, what does success look like in 10 years? And what would have to be true for us to say that we truly move the needle in mental health?
I have to get my crystal ball out.
I love it. We all need one of them.
I always say, what would I like the Daily Telegraph to say about me in 10 years' time? What would be on the front page?
Yeah.
I think if we had an integrated system of care that was technology-led with a human in the loop, and every single person in this country, young person, had access when they need it the most, we have achieved our ambition.
Amazing.
Now, that's ambitious within itself, but it is possible.
Totally,
and it's possible through people like yourself and Innowell and other organisations who get on board to make it happen. So we can't do it on our own. We are not going to be the Googles of the world. We're not that, but we know we can be that through partnerships. And I think if digital is only going to advance itself, and it will very quickly, then how do you embrace technology? Young people. And the best thing is we live on an island, right? We live on an island. We can do it. And there's connectivity as far as Cape York, across to WA. Like, we can do it. And so why not? I would love for, a 7-year-old to get online and talk to someone, or through our technology to get help. That purely is, we've helped people. Like, that is the dream. And it is possible.
It is, absolutely. And as you said, it takes more, these conversations, more partnership. As you said, there are so many incredible organisations out there trying to trailblaze their own way in mental health. And that's very noble. But as you said, it's really hard. So the more that we actually partner together, it's not a competitive scenario, and it should never feel like a competitive scenario. It's like the more we partner up together, the more of an impact we're going to be able to create. And I know that, there's some great things that we can continue to do as our two organisations. So, I think it's really exciting, in terms of what that future could look like. And so my final question, if you had a magic wand and there was something that you could make true overnight, what would you change?
In fact, I'd like every young person to wake up tomorrow and know that they could reach us and get the help they need. And so the change part would be that every young person knew about ReachOut. And scalability is important for us, but we also have a reality check that not everyone knows about us. If people knew about us, and to Thorpe, to you and I's first question is, we wish we knew this existed. If we wave that magical wand over this country and people got help, then that is a dream come true, because that is ultimately why we all exist. And that sets someone off on a trajectory that potentially they may not have for another 5, 6, 7 years.
Absolutely. That'd be absolutely amazing. It's a dream, but as you said, it's not possible. It's not unrealistic. So even though it's a magic wand, I think that future is very much not too far in the distant future for us, Gary. So really exciting times. Amazing. Gary, I have loved our chat. We could have continued for another hour. I've absolutely loved our chat. Thank you so much for joining me on our In Our Minds podcast. Love getting to know you. I know we're going to continue to do more things together. Thank you for your passion and everything that you're bringing to this community, both in the past, and I know what you're going to continue to do in the future. I'm really excited to be a part of your orbit. Thank you so much.
No, thank you. And thank you for the chat, because it's chats like this that actually start to raise awareness and get the collabs and the partnerships we need to actually do the magic wand approach. So absolutely. Lovely talking.
Absolutely. Pleasure. Thank you so much. Appreciate it.